Human Resource Officer at the Learning and Development Directorate, Ministry of the Public Service. The Learning and Development Directorate, Ministry of the Public Service, in collaboration with the Psychiatric Hospital, is proud to present to you this webinar presentation and discussion on managing your health through the COVID-19 pandemic. Our rules of engagement for this presentation are as follows. Kindly mute your microphone and disable your video. Pause and/or minimize any distractions as much as possible. I'd like you to fully focus on the presentation. In addition, I would like you at various stages or points during the presentation to take time to reflect on your own experiences. Important enough, enjoy the presentation. Please note that you will be able to post your questions to the presenter and share what you have learned. And this will be done via the chat option. And this chat option can be seen at the bottom of your screen. And at various stages during the presentation, there will be a question and answer segment. Kindly note as well that we are recording the presentation and it will be made available afterwards. It's at this point, I'd like to introduce you to today's presenter, Dr. Joanne Braffett-Drummond. She is consultant psychiatrist at the Psychiatric Hospital. Over to you, Dr. Braffett.
Good morning to all. I am going to start sharing my screen now so that we can get on with the presentation. I'd also like to thank the Learning and Development Directorate for their assistance. All right, so today we're going to talk a bit about managing your mental health through the COVID-19 pandemic. Mr. Ellis would have highlighted the rules of engagement. I'm going to stop at the end of each section so that you can, in fact, ask your questions. And as we will see, that is actually an important part of being able to manage your mental health in the COVID-19 pandemic. So let's get started. Today, I want to start with a definition of mental health. We're also going to define well-being, which is also very important. We're going to look at what psychiatrists and psychologists call the biopsychosocial model of disease and how that applies to COVID-19. We will look at understanding stress, its link to COVID-19 and its effects on the body. We'll look at resilience and stress management. And then I will touch on two special considerations: the impact of online platform use, and we are using an online platform today, as well as caution fatigue. So, mental health, and this might be a definition that you all would have heard from time to time. It's defined as a state of well-being in which every individual realizes his or her own potential, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to their community. So this is not a situation where an individual does not have a mental disorder. It's not simply the absence of a mental disorder. So just because you may not be my patient or somebody else's does not mean that you are mentally healthy. If you can look at the definition and you'll realize that lots of people worldwide fail to meet that definition. The other thing that I would like to highlight, not necessarily for this presentation, but in general, is that if you look at that definition, a person can lose their mental health, but based on what causes them to lose their mental health, whether it's something that is temporary or reversible. So if a person, say, has a house fire and they lose all their possessions, or there is a death in the family and it's sudden and unexpected, then you may find that for a period of time, a person cannot cope with the normal stresses of life, or they may not be able to work productively and fruitfully. But just as mental health can be lost for a period of time, a person can regain their mental health. So I just want to introduce at this point that mental health, just like physical health, can be lost for a period of time. But unfortunately, persons have the view that if a person loses their mental health, if they're diagnosed with a mental disorder, then that's it. They're immediately off the table, can't function going forward. Sometimes people think you become incompetent and you haven't a say, or you're unable to actually contribute. And that is definitely not true. As long as an individual is able to meet this definition, then they should be able to proceed with life. What is well-being? It's a state of being happy, healthy, or comfortable. It's a positive outcome, according to the CDC, that has meaning for the individual as well as for society. And it integrates, importantly, both mental and physical health. So when we're talking about well being, we are looking at the whole individual. But do be clear that mental health is an important part, an essential part of well being. Now, as psychiatrists and psychologists, we tend to look at health in general and not just mental health, physical health, as having several components. There's the biological component, there's a psychological component, and there's a social component. And all of these parts of life interact to determine the state of an individual's health. Now, when we look at COVID-19, you can see where that would have a significant impact on mental health. So, from the biological standpoint, if a person actually becomes ill and actually develops COVID, or the potential of illness and the stress that we would all have been under since the pandemic started, that would in fact put you at risk of being ill, the worry about being ill. So, that is a significant biological component. One of the things that has been noted, not just here in Barbados, but worldwide, is an increase in substance use, alcohol, in some instances, caffeine, and sometimes illicit drugs as well, in order to cope. Those have an impact on a person's physical and mental health. Some of the psychological effects that have been seen during COVID-19, we talked about increased worry, for some persons, if there is an existing mental illness. So, for example, I've had clients who suffer with depression and anxiety, and they have seen an increase in their symptoms or even a return of symptoms if their illness was well controlled prior to the pandemic. Since the onset of the pandemic, they've actually had worsening of existing illness. We have seen, again, not just in Barbados, but worldwide, an increase in domestic violence rates, especially during the period of lockdown. And as other stressors mount, separate and apart from the biological stressors, as other stressors mount, we have also seen that related to increases in domestic violence. And from a social standpoint, I've had especially elderly clients complaining about the impact of lockdown or even distancing measures leading to social isolation. And they have found that their mental health has suffered. There's a client who had been off medication for many years. And during the lockdown, unfortunately, she was sheltering in place, and her children, who visited frequently, stopped visiting as often. She was not going to the supermarket, her things were being brought. And for her, not having that day to day interaction, not being able to go out, get involved in church activities, and so on, actually led to the development of a full blown anxiety disorder. And she found herself being treated for that for the first time in 74 years of living because of the severe isolation and loneliness that she experienced. Other social problems that are related to the COVID-19 pandemic that would have affected mental health include financial problems. We have numerous persons out of work, numerous persons who are unable to pay their bills, do for their children what they would like to do. And that has led to significant financial stress and worsening of mental health. We've also seen, and again, not just in Barbados, not unique to us at all, an increase in crime rates in many locales, which have in fact led to an impact on the mental health of not only the persons who are direct victims of crime, but on society in general. And this is by no means an exhaustive list. This just gives you an idea of how several factors related to the COVID-19 pandemic would, in fact, affect mental health. And stress is, in fact, the final common pathway because stress itself is how everything that changes around us impacts the human body from a physical or from a mental health standpoint. So, what is stress? In 1979, a psychologist by the name of Selye would have referred to stress as a non-specific response of the body to any demand made upon it. And that's fairly simple. Um, Basically, when things change, whenever our equilibrium has to be reset, then that is a stressor. And notice I'm not saying when things go wrong or when bad things happen, because we often think, okay, I'm under stress because I have had a negative outcome, or I'm having problems at work, or I'm having problems at home, and those things are stressful. We tend not to look at positive changes as being stressful. So, promotions, getting a mortgage, getting married, and this is even happily married, having a baby, all of those are positive changes, but they can in fact lead, they do in fact lead to some measure of stress. So I want you to go forward with that, that stress is not necessarily bad change or bad outcomes. Stress and change are almost equivalent for the body and for the brain. And how does stress affect the body? What does your body do? Well, in acute phases, so if someone had to run into whichever room you may find yourself at this particular time with a firearm, then that would lead to an acute stress response. You would have the release of adrenaline, and that would trigger what is called your fight or flight response. So you will either prepare to lash them with a chair, or you will try to get out of the room as quickly as possible. So that is your fight or flight response. And after a period of time, those hormones are supposed to return to level when that stressor has been overcome. However, with ongoing stress, we tend to have another hormone being produced, a hormone that you may have called cortisol. And that tends to have, especially if it's a sustained increase, it has deleterious effects on the body. And we're going to take a look at those. So you should be able to see on your screen just some of the effects that cortisol, especially long and sustained increases in cortisol, have on the body. So you can see headaches, feelings of despair, a lack of energy, sadness, and you will recognize those as symptoms of depression, nervousness, anger, and irritability. So again, mental health symptoms, trouble concentrating, difficulty with memory. And that doesn't mean that it causes you to have dementia, but when you have lots going on and you're not able to focus, then you're not able to take in and encode information, and therefore you're not able to remember it because you can't put out what you don't take in. So you may find difficulty with memory. Some persons have challenges sleeping, and you may in fact develop full-blown mental disorders, um, increases in heart rate, so heart beating faster, a rise in blood pressure, and later on in our talk, we're going to see why that is so significant, increases in your cholesterol levels, and if those remain unchecked over time, it can actually increase your risk of having a heart attack. Indigestion, burning of the stomach, increased risk of diabetes, we would have seen as well in the pancreas, and a higher blood sugar in general would be seen. Changes in bowel function in the intestine and other digestive issues. In women, you can have changes in the period. So you may actually find that a person who is under stress may say, okay, I've missed a period, I'm not pregnant, I'm not sure what's happening. But that is, in fact, what is happening. That stress, because of the high levels of cortisol, it actually suppresses reproduction. So not only may females notice that they have missed periods, but they may also find that they're trying to become pregnant and they are unable to do so. Other issues that can arise: acne, other skin problems, muscle aches, tension, headaches, and increase in problems with the immune system. So if a person is under stress, they may also find that they are having difficulty fighting off colds. And the immune system, interestingly, does not only deal with infection, it also deals with cancer suppression, because over time, some cells in the body often go through precancerous change. And part of our immune system's function is, in fact, to destroy those cells before they actually take hold. So, over time, long periods of stress, because of that immune suppression, can actually increase your risk of certain cancers. With respect to prolonged stress, we all need some measure of stress in order to function. Um, so a person may find that without some challenge, without some stimulation, then there is difficulty functioning. So we do need a challenge. We do need some change in order for us to reach peak performance. However, after a person has been under prolonged stress, there is a state of exhaustion that is reached, and then that can lead to breakdown and illness. So, the development of illness, when there is no mechanism put in place to alleviate or adequately cope with stress, leads to illness. Some of the signs and symptoms of stress that we would have seen: recurrent panic attacks, neck pain, back pain, muscle tension, palpitations, indigestion, insomnia. So, all of these are things that we would have seen. So, before we go on, I am going to pause here so that we can have any questions on stress before we start to look at stress and stress management.
Colleagues, you can feel free to post your questions in the chat so that Dr. Braffett can answer them for you. I'm not seeing any questions as yet, Dr. Braffett. So
Righto.
it
I'm gonna
appears
ask because I'm seeing there's a Galaxy A1 that is making some interesting scrolls across the screen. Is anybody else seeing that as well?
I just saw that.
Okay, so I'm not so sure where that's coming from because it's not
Okay,
mine.
okay. I'm
All
sure as
righty.
well.
All right, well, I'm going to continue. Let's talk a bit about resilience and stress management. So, resilience from a mental health standpoint is the ability to bounce back or to adapt to adverse or challenging situations. And we just talked about the fact that being able to adapt to change is what will in fact will in fact prevent us from undergoing prolonged stress. It is, in fact, a mindset that is associated with certain types of behaviors. There are certain hallmarks of persons who are resilient. It does not mean that you don't feel anything. It does not mean that you don't have an emotional response. So, a person who cries if they hear bad news, or a person who may feel down or less motivated for a period of time because they have had a significant stressor, it does not mean that that person is not resilient. So it is not about being hard as a rock, not looking at your emotions. In fact, quite the opposite. Resilient persons have a realistic view of life. So it's not a situation where you're in denial, things are changing, and you refuse to react to them because you refuse to even look at them. Persons who are resilient do have a realistic view of life. So it's not about being blindly optimistic in the face of challenges that need to be addressed. Persons who are resilient often possess very good communication skills. And as we go through today, we will look at the importance of having good communication skills. Being able to solve problems is another hallmark of persons who have resilience. And it's not a matter that they have all the answers. We will look a bit at problem solving as well. Persons who are resilient also have very good impulse control. So they do not respond impulsively or take rash actions or decisions when they are faced with challenges. They tend to analyze the situation and work through, and there is a clear and reasoned process by which they arrive at their solutions and the actions that they take in order to reduce their stressors. They also have what we call a high emotional IQ. So those persons are very self observant. They're able to look at and examine carefully the emotions that are being produced by a stressful situation, whether it's sadness, anger, irritability, and they take steps in order to reduce negative emotions and to foster positive emotional responses. They have supportive relationships, so not relationships in which they necessarily are always taking, or relationships in which they are only giving, but supportive relationships that are mutually beneficial. They often have positive role models because the answers to the challenges that life poses don't all rest with any one individual. And we can often learn from others around us, whether they have been through similar situations or if they have expert views or expert opinions that they're able to share. So, positive role models can also improve a person's resilience. And having good self confidence and good self esteem is very important in terms of being resilient. And for some persons, having good self-esteem seems to mean, well, you just look in the mirror every morning and say, I'm wonderful. Having good self-esteem means that you accept yourself, both your positives and your negatives, because everyone has areas of weakness that they need to work on. We all have strengths. So being able to accept yourself, both your strengths and your weaknesses, while working to improve on the areas in which you are weak, is what good self esteem is about. How then can we build resilience? Well, making your mental and physical health a priority is very important. Being able to foster mutually supportive relationships. And we talked about relationships that are, in fact, mutually supportive. So not situations, not relationships in which you are in a constant state of output, where the other person is a drain on you and you are not in any way restored by that interaction. Mutually beneficial relationships. Developing a positive but realistic outlook on life is very important. Being able to differentiate very quickly between circumstances that are within your control and the ones that are not in your control. Being able to accept change is also a very, very important part of building resilience. And that actually draws on some of the tenets of mindfulness, where You're aware of what is happening. You're not frustrated with trying to make things different because you need to accept change. But while you are in a situation, if it is a pleasant situation, you enjoy what is pleasant about it. You are willing to accept that in life, things do change. Therefore, at some point, things are not necessarily going to be pleasant for you. However, when you are dealing with unpleasant situations, you face it knowing that things will not always be unpleasant. So, that acceptance of change and acceptance of the situation as it is while working towards positive change is an important part of building resilience. So, before we go on to stress management and the strategies for daily life, does anyone have any questions before we go on?
Yes, Dr. Braffett. Question just going back to what you would have mentioned about stress.
Mhm.
Question, how do I stop having, say, anxiety dreams?
Okay, dreams are interesting. Um, One of the oldest psychologists in the field, Freud, would have said that dreams are the pathways to hidden desires. Most persons do not hold to that belief anymore. If a
Mhm.
person is anxious and that is actually interrupting sleep, then we certainly need to make adjustments in daily life to reduce stress levels and to improve sleep hygiene, so, involving things like reducing the use of stimulants, having um, your last meal at least 2 hours, 3 hours before you're planning to sleep, um, having daily exercise, but not within the 2 hours prior to sleep, reducing the use of alcohol, which can fragment sleep, and then, if we find that the sleep hygiene is not working, that person may need to seek professional help with respect to addressing whatever is causing the anxiety, coping with the anxiety, or they may need to use a sleep aid for a period of time.
And you just mentioned about the sleep aid. All right. So in addition, why when I lie down on my couch and say feel sleepy and start to doze off, and then suddenly I get up and go to my bed, and for some unknown reason I find I cannot sleep now.
That often happens because you've interrupted your own sleep cycle.
Mhm.
And that's the thing, dozing off in the couch is one of the things that is known to prevent sleep. Dozing off in bed or using bed for something other than sleep can also interrupt normal sleep habits. So, having a set bedtime and at that time, reducing distractions, cutting down light, making sure that the room is as cool as you can tolerate, because it has been found that sleeping in warm environments can be more challenging and it actually leads to interrupted sleep. And once you've done those things, when you go into bed and bed is about sleep, then you tend to find that you have a better rest. But once you interrupt your sleep cycle, lots of persons have difficulty going back to sleep.
So somebody may ask then, should I stay on the couch then and sleep instead of going to my bed?
I would say if your back can take it and the rest of the household does not have an issue, then you can consider that. But generally, couches are not the most comfortable places to sleep.
Right. Okay. Another question here. I'm saying someone was asking about healthy esteem. I'm wondering whether they're relating it to when you were looking at building resilience.
Okay, what was the question?
All right. They're asking about healthy. What about healthy self-esteem? Does healthy self-esteem affect you in terms of stress or so?
Yes, it can, because your self esteem, as I would have said, refers to your acceptance of yourself. And if you do not accept yourself, then it is going to be very, very challenging for you to have those healthy, supportive relationships. If you have a negative self view and that is persistent and it's pervasive, it is going to prevent you, from managing your day-to-day life. If you have a negative view of yourself, when you are faced with challenges, your automatic thought is going to be, because I am not good enough, I am not going to be able to manage this situation, I am not going to be successful, I am not going to be able to cope. And when you have those negative thoughts, as we'll see when we go through stress management, they certainly do impact your ability to function. In relationships as well, um, you are more likely to be taken advantage of, to be frank. If your view of yourself is that you are less than others, that you are not deserving of things that are good or of treatment that is good. So, if you have low self esteem, it is going to impact you in your day to day function. And certainly when you are presented with challenges, as we all are in life, your ability to cope is going to be much lower than that of someone who actually has good self esteem.
Great. And you have that very, calm and voice that how based on how you're saying it as well. So just one final question before you move to your next areas. In your
Sure.
question is asking, in your experience, are
Mhm.
employers willing to accommodate persons who are experiencing mental health, stress-related issues?
To be very honest, I have found that not just employers, but in general, there is a significant amount of stigma that is associated with having a mental disorder or having any type of mental health problem. And it is one of the biggest barriers to help seeking that we see as mental health professionals, because persons don't want that stigma attached to them. People are even more likely to come forward and say, well, I have cancer, than
Mhm.
they are to say to an employer or to their colleagues, well, I was diagnosed with depression or I have to see a psychiatrist. Because as I would have pointed out when I started the presentation, when we look at mental health, people tend to think that as long as there is a loss of mental health, that it's irreversible and that individual is now incompetent. And then persons start to use negative terms like crazy and mad. And it can be very, very difficult. A lot of patients will say to me that the stigma and the discrimination that they face is often worse than the illness itself. So that unfortunately creeps into the workplace because persons take their attitudes with them to work. So whether it's employers or colleagues, you find that persons can suffer a tremendous amount of discrimination if they disclose um, that they have a mental health problem. It is really concerning because one of the things that all employers need to be aware of is that happy, healthy employees who have a high state of well-being, yeah,
Mhm.
of
Okay.
physical and mental health, actually do better. Health and well-being
Mhm.
are important productivity inputs. So if you have a worker who is not mentally healthy, getting rid of them is not the answer. Allowing that individual to seek help and to get the assistance that they need, and allowing them to reintegrate and earlier, because we often have a significant delay in persons coming for mental health assistance because of that stigma. But when persons are able to get help early, and reintegrate into the workplace, sometimes I often have to say to employers that hour that they may need to come to clinic and get the help that they need doesn't necessarily have to be medication. It might be talk therapy. They may be seeing a psychologist for psychotherapy. But that hour where they are in the workplace for the other seven and functioning at a high level is better for you, because one of the things that is also unseen is presenteeism, which we're not going to talk about in this presentation today. But briefly, there's significant issues with presenteeism. People figure, oh, you lose your mental health and automatically you stop coming to work. Sometimes persons who are mentally unwell attend work for years and their productivity is extremely low, but they're still there. They're not fired. It is just that the employer is not getting out of that person what they would if their mental health problems were in fact addressed. So we need to be aware of the fact that persons, if 1 in 4 persons worldwide have a mental health problem during their lifetime, then that's going to be in some workplaces, it's going to be in some schools. Therefore, we need to be very aware of mental health problems, allow persons to get the help that they need, and allow them to reintegrate into their workplace so that they can have a return to full mental health, which we would have seen involves being able to work productively.
Okay, thanks, Dr. Bradford. So you can continue.
All right, so off we go on stress management. So, the first thing that we need to look at with stress management, we talked about the fact that even positive change can be stressful. So, stress management is essential because good things changing or things changing for the better or things changing for the worse, both can be stressful. The first step is to realize that it has to be an ongoing effort. It's not going to be a one off intervention. So when people think stress management, I often hear, yes, I need to take vacation, which is going to give you what, 2 to 4 weeks out of 52. Now, when you think about it, if you wanted to lose weight, you're not going to take 2 to 4 weeks, eat nothing but lettuce, and then go back to eating as you did for the rest of the time. Okay, you're not going to do 48 weeks of eating macaroni pie in double portions and cheesecake. And yes, these are all the things I like. Um, and expect that eating lettuce for 2 to 4 weeks was going to solve the weight issue and maintain the weight loss that will happen in the 2 to 4 weeks. 2 to 4 weeks after, you're going to be back to the same weight, if not bigger, and you will continue to gain thereafter. Similarly, if your doctor said to you, you need to take off 5 pounds or you need to take off 10 pounds in order to manage your blood pressure better, you wouldn't take 2 to 4 weeks and exercise morning, noon, and night, drop 20 pounds, and then hope that that is going to be sustained when you stop exercising for the other 48. That's not going to happen. So it has to be an ongoing intervention, just as other things in our life, managing our money, cleaning our home. I sincerely hope nobody here only cleans 2 to 4 weeks and has the house spotless for that period of time and then goes back to living with all sorts of dust and dirt for the other 48 or 50 weeks of the year. So ongoing, it's not about just taking 2 weeks vacation, it is about daily management of your stress. So let's look at the strategies. The first is self-observation. If you don't look at yourself, if you are not in touch with yourself, and we talked about this in terms of having an emotional IQ, if you are not, and it's not just about your emotional health as well, your physical health, if you are not looking at yourself, how the situations in your life are affecting you, if every time you get within 5 meters of the door to your workplace and your heart rate skyrockets, or your blood pressure goes up, or you start to have a headache, or the muscles in your neck start to get tight, or you start to feel nauseous, or if that's happening when you're getting home, depending on what stressors or situations exist in the home. If you're not aware of that, you're not going to say, okay, something is wrong and I need to do something about it. So we need to be self observant. We need to look at what is happening with us as opposed to just going blindly through life. And often that is how persons end up with me. They start having the headaches and the indigestion and they're not sleeping. They go to the GP, which is not a bad place to start. But sometimes when they themselves are not able to link the situations in their life with the physical changes or the emotional or mental health changes that they're having, when they get to their GP's office, they end up having investigations for headache. So you have a battery of lab tests done to the point where you're nearly anemic, or you end up having reams of radiological investigations, so the x-rays, for the back pain and x-rays for the neck pain and the CAT scans for the headaches. So by the time they get to the psychiatrist, they're anemic and glowing in the dark from the types of investigations that they have had, not literally, but you understand my point. And you go through needless physical investigations only to find out, okay, this is in fact a mental health problem. And after having gone through all of that, sometimes persons get to the psychiatrist or the psychologist and they're quite offended. I don't understand why I've been sent here. Nothing is wrong with my head. Fair enough. I say to them, well, I see you've had lots of blood tests, everything is fine, all of the investigations are quite good. Can you tell me what's happening in your life? Things are good. Okay, are you having any problems? No, so I don't understand why I'm here. But then, remember we talked about positive change being stressful. So I hear about the fact that they may have had a new addition to the household, maybe an elderly relative with dementia, or they've had a new baby, so that's a significant change. They may have had a promotion at work, which is wonderful. It may come with increase in salary, but it also comes with an increase in responsibility. And you're now just not only responsible for your own output, but you are responsible for the output of persons who are your juniors. And that has associated stress. They may recently have been married, and that is a good thing, and the marriage is going well, but you're now living with someone that you may not have been living with before. You may have had expenses coming out of that, or the stress of dealing with a wedding planner. All of those are things that are good changes, but extremely stressful. And then when we start to talk about things and I start to list the stressors, then they realize, oh my goodness, all right, so I have been under a lot of stress. I didn't realize that. So that's why we talk about stress. That's why we look at change as the main mediator of stress. So look at yourself. You need to be aware of what is happening with you before you're actually going to put anything in place. Because if you don't realize that you're under stress, you're not going to do anything about it. Time management is another very important part of stress management. And in our current climate, lots of persons are unemployed. Employers everywhere want to see high productivity, high output, and with the use of virtual platforms, um, time in and time out has become very blurred. There is a false belief, and we will look at that as well, that persons are available 24/7 just because they can be reached electronically or by virtual platforms. You need to be very boundaried with respect to the time that you start work and the time that you end work. Yes, you need to be flexible where required. So there might be days that you need to go in a bit earlier or you may need to stay later, but you simply cannot be in a state of output 24/7 and expect to be healthy. You need to set realistic goals as well. One of the things that we often do is to create to-do lists that simply ruin our days. If you have a to-do list that simply cannot be achieved in 24 hours, you are setting yourself up to feel stressed, because no matter what happens, no matter how productive you are, if it is not realistic for the number of hours that you would be awake or the number of hours that you would be at work, there are always going to be things left over, things that carry forward into another day of unrealistic to-do lists. Therefore, you need to be very realistic with what you put on your to-do list, because every time you look at that list and you see the mounting numbers, it increases your levels of stress. So set realistic goals, and wherever possible, you try to adhere to a schedule. Yes, things change sometimes, and as we said, you do need to be flexible, but wherever possible, try to adhere to a schedule. Relaxation techniques are another important part of stress management. And remember, I'm not talking about the 2 weeks of vacation, because you cannot go, as my grandmother would say, like a Joe Heat mare for 42 for 48 or 50 weeks of the year and expect that 2 to 4 weeks of vacation is going to be enough. I'm talking about relaxation techniques, and these are things that you employ almost every day, if not every day. They're different for different people, different things work for different persons. So, breathing exercises, yoga, imagery, prayer, meditation, taking part in hobbies, pleasurable activities, mindfulness. And this is again not an exhaustive list. There are other things that persons do that they find relaxing, and that is perfectly fine. I want to make note though that although this list is not exhaustive, sleep would never have been on it. Sleep and relaxation are not the same thing. You cannot go at a constant rate for the entire time that you are awake, crash, sleep, get back up, and repeat every day. That there has to be a period of time during the day where you engage in some sort of relaxation, even if it is 15 minutes, half an hour out of the 24 that you have. Relaxation is something that occurs while you are awake and alert. Sleep and relaxation are not the same thing. We talked a bit about positive thinking and having a positive outlook. And for us as mental health professionals, cognitive restructuring is really just a term given to positive thinking. So your mood and anxiety levels are affected by your thought content. If you think negatively, it is going to lead to negative emotions and negative behaviors. And that also ties in to self-esteem. Because if your thoughts about yourself are negative and that you are grossly inadequate, then you are going to have feelings of sadness. You're going to face most of your challenges with tremendous doubt. And that often causes you to become a self-fulfilling prophecy. If you get, and that type of thinking also relates to the challenges and situations that you will face in life. If you have negative thought patterns, if you look at situations, even your day to day life, and you get up, or at the beginning of the week, you start the week by saying, this is going to be a horrible week. They're going to kill me with work. I am not going to get through. Those are the types of thoughts that by the time you actually get to the office, you're already tired, because that type of negative thinking tends to increase negative mental states, and it leads to the release of stress hormones as well. So I'm not saying that you need to be blindly optimistic where you realize, okay, things are not going well, but you're just going to have a Pollyanna approach and smile sweetly and let everything burn to the ground around you. But at least having even a neutral response that you realize, okay, this could go either way. You acknowledge it's going to be a busy week or it's going to be a difficult situation, but I am up to the task and I am going to do my best to overcome whatever I'm being faced with. Absolutely. Those positive thoughts are actually very key to you being able to keep your levels of stress manageable. We had mentioned communication briefly, and effective communication is an extremely important part of stress management. When we have ineffective communication, it prevents us from being able to get what we need to say across and understanding what others are trying to say. Effective communication is essential for preventing confusion and misunderstanding. And in your workplaces and in your homes, you can imagine when things are not clearly defined, roles are not clearly defined or explained, when you thought that I was going to do it and I thought that you were going to do it. And then we are both finding ourselves in what Bajans would call potter, because at the end of the day, it is not done. And you are blaming me and I am blaming you. Effective communication can prevent things like that from happening. If we are communicating effectively, it expedites task completion. So I have had to communicate with the Learning and Development Directorate in order for us to have this presentation. What my role is, what their role is, how best we can work together has in fact helped us to put this on with limited glitches. And these are things that we have to realize. Making assumptions is extremely dangerous. So we need to realize that very clear communication is important. It also allows for venting of negative emotions, and this can be done in safe spaces and appropriately. So this is not the same thing as hauling off and cursing your boss. That is very inappropriate, and that is going to need to lead to even more negative outcomes. But in an appropriate fashion, if you can vent negative emotions and articulate your concerns, that is very important, and it can aid in problem solving. And that takes us to problem solving. So, one of the things that I often have to point out to persons in the course of my work, and this is not persons who aren't intelligent, some of these are colleagues, some of them are attorneys, persons from all walks of life. Worrying is not the same thing as problem solving. I love the ideal method because it takes us through very clear steps of what we need to do. You identify what the problem is. You define the situation and what needs to be done, and you explore your options. Yeah, you may have one option, you may have several, and you look at the pros and cons of each, and then you decide which one you're going to implement, and you take action. You take action and then you look back. Did this result in the outcome that I expected? And did it result in an outcome that solved the problem I identified? If it didn't, then you go back and you try another one of the possible solutions and you do the same thing. But sitting, procrastinating, being in denial, pretending that the problem does not exist, waiting forever, losing sleep, none of that is equivalent to problem solving. Problem solving is an active engagement and it is time limited. So it is something that you need to get on and deal with. I often say to people, do not leave your inbox full or don't allow it to get full. If you can avoid that, don't procrastinate because the mounting inbox in and of itself is a significant stressor. Load limiting is another very important stress management technique. The little infographic that we have here says, although I have the word no in me, I don't like to use it. Being able to say no, and this is not no to doing anything that is actually a part of your job description. So please don't go away from this saying that I said, go and tell your boss, I'm not working because I'm limiting my load. But there are always extra things that we take on that can increase our stress level. We're benignly or malignantly overcommitted. We feel overwhelmed, and then we're not able to complete tasks. We are not able to complete tasks by deadlines, and that results in a significant increase in stress levels. So, if you know that you are already involved in several organizations for which you have commitments, you have a full time job, you have family life, you need to be very careful about adding to that. Sometimes you do have to say no. It really is not possible to do everything all the time. And one of the things that I have learned is that people don't stop asking. So if you do not establish those boundaries for yourself, have a clear idea of what you can manage, and when you realize that the extra things that you are taking on are cutting into things like your own relaxation and the things that you need to maintain your health, then that is a clear sign that you need to start limiting your load. And being able to limit your load involves saying no. And calm assertiveness is important. So you do need to be able to represent yourself in a definitive manner. Again, this is not hauling off and cursing anybody. You explain what needs to happen. You decline to take on additional tasks in a way that maintains your self respect and is also respectful of others. We need to avoid what mental health professionals call maladaptive coping mechanisms. And often these are things that may feel good at the time, or momentarily reduce stress, but in the long term, they actually have a very deleterious effect on your health. Denial and procrastination, we talked about those. Substance misuse. So, using caffeine to wake up in the morning because you have not had adequate sleep, drinking it throughout the day as you consume high levels of sugar and fat, and then using alcohol or prescription or non prescription sleep aids to get to sleep, and then repeating that cycle, that is not an adaptive way of coping. Acting out. So, being under stress and taking that out on colleagues or on your children or on other members of your household or your friends. That is not an adaptive coping mechanism. It certainly is not going to allow you to foster those mutually supportive relationships that we talked about. And it will, in the long term, have a negative effect on your mental health. Binge eating, again, I often hear, oh, I eat when I'm under stress, or I eat when I eat when I need comfort. Definitely not a way of coping. So the tub of ice cream may feel wonderful at the period of time, but when we look at the effects of stress on the body, binge eating actually pushes a person towards a greater state of ill health. And then unhealthy impulsive risk taking. So for those who have fast cars, leaving work and trying to drive on the right side of the highway, going all the way home, that is definite to blow off steam. That is definitely not a good way of relieving stress, engaging in unhealthy, risky sexual behaviors as a means of relieving stress. Again, not an adaptive coping mechanism. So, what are the good coping? And again, we have a little slide here that shows again the effects of cortisol and prolonged stress on the body. We had talked about an increase in blood pressure. We had talked about an increase in blood sugar. And I want you to bear those in mind as we go forward. Yes? So, just some humorous pics that give us an idea of some of the things that persons do when they are under stress. So these are definitely not adaptive coping mechanisms. So, what are the adaptive coping mechanisms? What are the good ways of managing stress? Well, having a healthy diet. Um, when people come and they've seen the psychiatrist and they say, okay, what are we going to do about this? And my first thing is, well, tell me about your diet. I kind of get the sideways look. Like, what does that have to do with my mental health? Well, as I say to persons, it is extremely difficult and in some cases impossible to have a healthy mind in an unhealthy body. Yeah, almost impossible. So, a healthy diet is a very important place to start. Remember, we would have seen a couple slides ago that being under chronic stress increases your blood pressure and increases your blood sugar. So, when you crave the sugary, fatty, salty foods when you are under stress, you're already having a high state of cortisol, which is pushing you towards higher blood pressure, higher blood sugar. And when you eat like this, then you can see that it's not a stretch, sorry, that being under stress pushes you into a state of full blown hypertension or diabetes. And that is where that link comes in. So, when under stress, a conscious decision to ignore the cravings for this salty, sweet, fatty foods is important for stress management. And I know at the end of a day where a person has had a very difficult meeting or significant stressors during the course of the day, nobody goes home and says, oh gosh, I've had such a hard day. I really deserve that extra portion of salad. Nobody ever says that. Nobody says, gosh, this is the day that I should forego the pie because I had a terrible time at work. But it is that conscious decision to eat healthily, even when you are under stress, that will save you from going on to chronic non communicable disease states. Regular exercise is also important. That's something that I raise with clients, no matter what they're coming for. Doesn't matter what type of disorder you have been diagnosed with. Doesn't matter if it is just that you are having adjustment challenges. Regular exercise is an extremely important part of stress management, and you're aiming for, as long as your physical health can support that, uh, 30 minutes a day. So literally just 1/48 of your day needs to be devoted to exercise, maybe 5, 6 days a week. It is always good to have a rest day. So, regular exercise is an essential part of stress management. We talked under relaxation techniques about engaging in pleasurable activities. If you have hobbies, people like different things, doesn't matter. Engaging in something that is not work, that is pleasurable for you, is important. Spending time with loved ones, and if it becomes possible, if it becomes necessary, sorry, it is important that if you need therapy, you seek professional help. There is no shame in it. It does not mean that you are going to necessarily end up on medication. And in fact, if help is needed, the earlier that you seek that help, the less likely you are to need some sort of medication. Yeah, because just as if you were dealing with, say, high blood pressure, your blood pressure was creeping up and you're getting to, say, 140 over 90, your doctor may say to you, okay, I'm not going to start you on medication. It's only now beginning to go up. I want you to start cutting out salt and I want you to start exercising, and we'll see if you can be controlled with lifestyle modification. That is the same with many mental health problems. If we can actually put things in place, if we don't wait for long periods of time until complications arise, then the use of medication can often be avoided. So, seeking professional help, if it is needed, is very important. So, before we go on to the negative effects of virtual platforms, do we want to break here if you have any questions on stress management?
Yes, again, Dr. Braffett.
Yes,
Some
I'm here.
questions here. How can one initiate a conversation with your employer if you are experiencing work-related stress, which is affecting your health?
Righto. Well, first of all, from my point of view, if that is something that needs to be done, preparing and making sure that you are able to communicate your concerns effectively is important. So, first of all, I would say look at the stressors that exist. Are you, whatever the situation is it that you are being asked to do things that are outside of your purview or that you are not equipped to do or trained to do? Is it that your department is short of staff? I think if we're all government employees here, most of our departments are short of staff, so that may already be a checked box. But be able to identify clearly what the problems are. See if you, as an individual, can highlight any solutions, any possible solutions, because going only with problems may not necessarily be met well. If you can't come up with a solution, then fine, but at least look and see if there are things that could be done differently, whether by you, by the organization. And don't go and say double my salary and things will be better, because that is not going to happen, especially if you're a government employee. But look at possible solutions and make notes, write them down. Then schedule an appointment to speak with your employer or your supervisor, whoever that person is, whether it's HR, your direct boss, whoever. So, bursting into their office is more than likely not going to be met well. You need to show that you respect their time and you say to them, I would like to have a meeting with you to discuss some issues. They may ask you what it is about, or they may not, but schedule that time. That way you can be prepared and you know that you will have adequate time to say what you need to say. When you have put those things in place, then you outline to your employer in a respectful way what challenges you are having. And if you have any solutions of your own that are reasonable and you consider that they're feasible, you outline those to your boss or your supervisor and say, well, look, these are the things that I think might be able to alleviate the stressors. You may get all of what you asked for, you may not get all of it, but being able to engage with your employer in that way is very important. It gives you as well a greater feeling of control, just being able to articulate your concerns as opposed to sitting at your desk day in, day out and stewing, trying to face situations that are not changing. So being prepared, highlighting the problems, articulating any solutions, and then scheduling a meeting with adequate time.
Okay. Just two other questions here before you proceed. What about
Yes,
reading? What about reading before you sleep or doing puzzles on tablets? Can these activities affect sleep?
they can, depending on where they're done and how. As we said, using your sleeping space for things other than sleep can be challenging, and doing things that are stimulating to the mind can be challenging. For some people, it's different. Some people find playing those little match three things or whatever, they find that relaxing. For some persons, they find it challenging and they definitely need to find the matches. And especially if it's something where there's a timer counting down and you're racing against the clock, that is in no way relaxing. So if it is something that is not stimulating to you, you're able to do this in a situation that is low, there's low light, because we talked about light as something, that bright light as something, even the blue light from your phone, as something that can impact your ability to have sound sleep, then I would not recommend it. But anything that is relaxing, then fine. But before you're going to go to sleep, falling asleep, doing something can, in and of itself, prevent you from having restful sleep. So even if you do puzzles or read, because that is something that's relaxing for you, that's fine. But at some point, closing the book, putting down your puzzle book, or turning off your phone or tablet, and lying still, getting your room to the temperature or the light level where it's optimal for sleep, at some point that should happen. That is preferable to actually falling asleep doing something.
Okay. And just two other questions. How do you explain a dream which continues for an extended period? And how do you cope with anxiety, say panic attacks?
Okay, dreams are funny. And that's a very broad question, and
Mhm.
it's different for different people. For a person, for example, some people will get up every morning and say, I dream every night. Some persons say, I never dream. So the significance of a dream to is very individual. Then the content of the dream is also very individual. So it's and the impact that it has, that is a very individual thing. Some people may have a terrifying dream, are easily able to relate that to something that they have met, that they have eaten during the day, or something they've experienced, and it's a one-off event, something that is happening, a dream that is recurring, especially if it causes distress. Then I think that is something that should be explored with a psychologist or a psychiatrist. And
Okay.
in terms of managing panic attacks happen for different reasons. Some are situationally bound. So, for example, some persons have performance anxiety. So, if they have to do public speaking or maybe sing or perform in some way in front of individuals, then that other individuals, that can cause panic attacks. And it only happens in that setting. Some persons only have panic attacks if, for example, they have to fly. So they may have a specific phobia, and that is challenging for them. Um, if it's situationally bound, their relaxation techniques, so breathing exercises, mindfulness, and other um, relaxation techniques that can be put in place. Some persons may need to use medication just at that time for situationally bound anxiety. So you don't have to fly every day. So if it is, for example, that you maybe fly once or twice a year, and some persons may use a short acting anxiety blocker just for the flight, and that's it, and you move on. You can also do different psychological therapies like exposure therapies and so on to reduce the onset of panic attacks that are situationally bound. If a person is having panic attacks that are not triggered by a stressor, because at this point, let me point out that anxiety is not always maladaptive. So I would have said earlier on in the talk, if somebody ran in with a gun, feeling a measure of anxiety is actually normal. And that is the body's response to being exposed to a significant stressor. So anxiety is not always pathological. When anxiety is excessive for the situation, so it's excessive for the stressor. So if you are responding to going to work or having to give a talk or something like that, like if somebody had a gun to your head, then that is excessive. Or if there is no trigger, so you're just driving along and there is a situation where you have just a panic attack, waiting at a traffic light, nothing has happened, or you're watching television, it's nothing that is frightening or so on, and then you have a panic attack, then those that are not triggered by a stressor, so they're just happening out of the blue, we consider those to be pathological. How can they be managed? Some panic attacks can be managed with psychological therapies. Some, in fact, require the use of medication. So, if you actually develop a full blown panic disorder, which some persons do, then stress management techniques and relaxation techniques or psychotherapies may not be enough. That individual may actually need to use medication in order to bring that type of panic under control.
Yeah, I thank you very much. So you can continue.
All right. So let's just talk a bit about some of the negative effects of virtual platforms. And we're using one now. And they can be, I'm highlighting the negative effects, but I don't want you to think that virtual platforms are purely negative. Doing this webinar this morning is more possible for me because I would have got into clinic around my usual 7:30, been able to make preparation. I saw patients before logging on, and I will return to seeing patients once we have completed this session. And I don't have the commute of trying to get to a physical location and the commute of getting back to clinic. So I am able to use my time more effectively and get more out of my day. So there are definitely positives, there are definitely benefits of using virtual platforms because of COVID. What is happening now is that, for example, yesterday evening, I would have had to log in and I was able to communicate with examiners in the Bahamas, Jamaica, and Trinidad, and we had cross campus mock examinations. And that gives our students here in Barbados and all the students who are in the doctoral program in psychiatry the benefit of getting feedback from several examiners. Normally, they would only have been able to get feedback from the local examiners. They get the exposure of being examined by several persons, and that's what happens in the final exam. So I just want to highlight that there are definite positives for using virtual platforms, but we need to be aware of the negative effects and how we can overcome them. So Zoom fatigue is in fact a real thing. It refers to the burnout or exhaustion that is associated with the use of virtual communication platforms. It can lead to significant feelings of tiredness and irritability, and it is an unrecognized cause of reduced productivity and increased stress levels. And because of the COVID pandemic, we've actually increased our use of virtual platforms. So we need to be aware of how this is affecting us. So one of the issues that contributes to so-called Zoom fatigue is transmission delays. So I'm not talking about when you have connectivity issues and your connection keeps dropping out. That in and of itself is a tremendous stressor. But even when you have the highest speed of internet and an excellent connection, there are transmission delays that happen there in the order of milliseconds. So you're not necessarily going to pick it up, but it happens. So this is happening. You are not hearing me as soon as I speak. Now, if I was using video, then my movements on camera, there would have been a delay in the time between my movement and its transmission to you. That actually has a significant effect on the way that we perceive each other when we are seeing each other on video. There are certain nonverbal cues that we use that are lost, facial expressions. I have had to see clients via Zoom during the lockdown, and it was extremely challenging. As a psychiatrist, a person's facial expression and changes in their body language are essential for me, and not being able to use those, waiting on delays to hear words, as well as my own facial expression and how that communicates what I am thinking and feeling to them, that was lost and it was extremely difficult. And that happens even when you're not trying to assess a person online. When we lose those nonverbal cues, making ourselves understood and understanding others becomes more difficult. It makes our brains work harder and it can be very exhausting. The psychological reward as well that we get from social interaction is very important for decision making. If you're doing something for someone or saying something to someone and they smile, that actually automatically influences your decision to continue, because that is a positive response. That's positive feedback that you are getting. And deciding what to type, how your facial expression is, what to say, is something that depends on nonverbal cues. It feeds through the reward pathway in the brain and it affects our decision making. So, again, because that is lost, because the reward pathway in the brain is being affected by what is being lost, it makes it more taxing for your brain when you use virtual platforms. And another thing that the use of virtual platforms can cause involves the use of video where you can see yourself. Normally, when you're talking to somebody else, you see their face, you can focus only on their face. You're not also seeing your own face. And the fact that they're competing images, you're trying to make sure that you can see what is happening with your face, how you look, how that look is affecting the other person while looking at their face. That check and balance that is always going on, even without you consciously doing it, can be extremely stressful and extremely tiring for your brain. Um, so if you have to analyze your own facial expression as well as the facial expression of others, worse if it's one of those platforms where you can see several faces and you're trying to focus on several faces in a meeting as well as your own, it is extremely difficult. That level of multitasking that has to be done that is not present in face-to-face interaction can be extremely difficult. So how can we do that? You would have seen I turned off. How can we reduce Zoom fatigue? I turned off my video. I turned it on briefly so you could see who was speaking, but I've turned off my video so I can't see myself. I want you to see the slides, but I've turned off my video because I don't want to have that feedback as well, because it makes me less fluent, because I keep switching from slides to my own facial expression. When you have meetings as well, um, if you can use audio where that's appropriate, then you do so. If it is something that only requires, say, a round robin by email, not because you have the facility of Zoom, do you call a meeting because it's cool. If emails can work or even a WhatsApp chat can work, then that's perfectly fine, because the use of virtual platforms can be extremely stressful. Again, you invite only those persons who are essential. So there is no need, if you're happy, you must have a virtual meeting, especially if you must use video. There is no need to invite the entire department if the entire department is not required. And if the entire department is required, but only for specific periods, if a person has to provide an update, let them provide their update and then leave as long as they have answered any questions that only they can answer. So essential invitees and essential participation only. Also try to avoid multitasking in meetings. So as I would have said to you, I am at clinic and the clinic is still going on because the senior nursing officers are in fact conducting the clinic. But I have come away from clinic, I have locked the door, I have moved my cell phones away. I've let persons know that I'm going to be offline so that I can focus on this, because trying to deal with this as well, which we have already highlighted, is more stressful than if I was doing a face-to-face talk with you, as well as trying to answer questions from the clinic or a signal to somebody off camera that this is something that needs to be done, or trying to deal with what's happening on my cell phone. That increases an already stressful situation. So avoid multitasking wherever possible in meetings, if possible. So if you're going to have a meeting and there are documents that need to be reviewed, to reduce the time that you are in the meeting, try to provide information to the participants ahead of time so that they can peruse it, make any changes that need to be required, or address matters quickly in order to reduce your meeting time. If possible, you encourage breaks. So normally, if I'm doing a talk like this, I wouldn't take questions in between. I normally ask people to note their questions and I take questions at the end. However, I broke between sections because it's important for my mental health and for yours, because using this platform, because it is more stressful, taking in information constantly is more difficult. It's also more difficult for me being in a constant state of output. So when we break and Mr. Ellis asks questions, I think about that, we share, at the end, if anybody has comments or so on that they wanted to make, we can do that as well, or they can make comments at the break. Those breaks in meetings, or if you're in classes or webinars, even 5 minutes, even if you can only do it at the halfway, can help to improve the productivity. So I know it's not common to allow persons to turn off their video or take a 5-minute break. And sometimes meeting hosts may think, well, if I let them log off or I let them go away, they may not come back. But if you don't allow that break, in the second half of your meeting, persons might be present but still absent. So it is important to allow persons to have those breaks. And we want to remove distractions wherever possible. So before we close with caution fatigue, does anybody have any questions about Zoom fatigue? Mr. Ellis, I'm over to you.
Yes, I'm not seeing any right now, but
Okay. Do you have any
I-
questions?
well, not right now.
All right. So
So we
let
can
us
proceed.
proceed with caution fatigue. And this is the last thing that I'm going to speak to you on. And it is something that I thought was very important to share. Um, COVID has been with us for a long time now. Um, and we've been taking precautions for a very long time. And that can leave you feeling very worn out because you have to adhere to safety guidelines. Sometimes you get out of your car and you walk to a building and then realize, oh, shoot, a mask is still in the car or the mask might be at home. Initially, we would have had a tremendous sense of urgency and a lot of energy about taking precautions. Everybody had their sanitizer, and you had several bottles, one in each handbag and in the lunch bag and at the desk. And we were really quite enthusiastic about taking those precautions. But after a while, the hope was that this was going to go away, but 6, 7 months in, we are still taking the same precautions. And the tendency is you kind of get tired of doing this. You get a little impatient when somebody says, oh, you can't come in without a mask, and you've left it in the car. You think, seriously, I had enough of them and this. And you get to be a little bit tired. It is natural. And because of that, we tend to reduce how closely we adhere to the safety precautions that we were serious about. But it's something that we need to overcome, because the truth is, even though we are feeling fatigue, clearly what we can see happening worldwide, and even with our cases creeping up, the virus is not getting tired. It's still with us, and based on what we are seeing happening, it's going to be with us for a while. So how do you overcome caution fatigue? Well, you think back to the beginning of the pandemic. And for those of you who have not known anyone who has had to spend time in the isolation centers or in quarantine, it is extremely taxing. For some people, it is one of the worst experiences of their life, bar none. When you think about what you would go through if you, for example, had an elderly relative at home, or you had someone at home, a child who was at risk, and you took the disease home to them, how difficult that would be for you, then absolutely. You think back and you think, okay, look at the impact, look at the risks and the benefits of my actions. Is it really too much to just sanitize my hands or to remember to wear my mask? No, it is not. Continuing the level of caution that you had before to avoid becoming sick and slowing the progression of the virus, in our case in Barbados, preventing us from having community spread, that is extremely important. You adapt a new mindset and you create a routine. The truth is, there are really three very basic safety measures: wearing your mask, social distancing, and hand hygiene. And reality is, that is not a lot to ask to prevent the spread of something that could actually cost you your life or cost a loved one their life. So you realize, since we've come out of lockdown, that we can live with COVID. You can work, you can still stay socially connected, you can exercise. All of that can happen while the safety precautions are ongoing. So focus on today. Don't throw your mind forward saying, man, I hope we ain't gonna be wearing these masks next summer because it's gonna be hot. I ain't gonna be able to manage exercise. You can imagine Christmas pictures and everybody in a mask. Focus on today. Do not get too caught up in the future. Focus on what is happening today, what you need to do today. Focus on maintaining good health, practice good self care. We talked about the things that are necessary for stress management. Demonstrate gratitude. We in Barbados have a whole lot to be thankful for when we see how persons in other locales have fared, how poorly they have fared. And because we live here, because we have been able to benefit from the measures that have been put in place, we have a lot to be very thankful for. Therefore, continuing our precautions is something that is important for each of us to do. And wherever possible, we care for others. Care for yourself first and others after. It might sound selfish, but there's a reason that they tell you when you're flying that if the oxygen tension in the cabin falls below a certain level, that you put your oxygen mask on first and then help others. You cannot pour from an empty cup. So practice self-care, and then you make sure that you care for others wherever possible. So I'm just going to leave you with this infographic that talks, it's the healthy mind platter. All of those things are important. We would have touched on all of those as we went through today's talk. Sleep, physical activity, time to focus on work, connecting with the persons that you love, playtime where you engage in pleasurable activities, your time for relaxation, your time in for work. All of those are things that you need to balance in order to have a healthy mind. So I thank you for your attention. If there are any questions arising from this section or other sections, you can feel free to ask. Thank you very much.
Dr. Braffett, thank you very much as well too. That was a very highly informative and timely presentation. And for you, the colleagues who've listened to the presentation, if you have any questions, we are going to be able to compile those and send them to you at a later date so you can review the presentation and the thoughts that Dr. Braffett has given you. Dr. Braffett, we are just about to wrap up. So I really, again, want to extend my thanks to you and to the psychiatric hospital for having this presentation. I'd also to like to thank my colleagues here and team members and technical personnel of the Learning and Development Directorate for their support in making this webinar possible.
All
Colleagues,
right.
that's all the time we have for. And as I said, your questions will be monitored and we'll send out correspondence to you in terms of the presentation. So have a good day
Thank you
and
so much.
enjoy the rest of your day. Thank you very much.